Hello, I am Zachary Mead, and today I'll be presenting on the sexual orientation and suicidality of a co-twin control study in adult men. So, a little introduction and methodology. So there's been several studies to have found that higher lifetime prevalence in suicide attempts in homosexual males compared to heterosexual subjects or population rates. This is even higher than homosexual females. These studies used either convenience samples, mostly without controls, or population-based samples, and a co-founding factor such as depression and substance abuse were not registered. This study sought to focus on all these variables, such as other substance abuse, other depression-based things, and so forth. This study used twins from a population based in the Vietnam-era twin registry. So a little bit more into the methodology. This study was an analytical sample of only 103 middle-aged male twin pairs from the sex registry, which were identified as one member of the pair reported male sex partners after the age of 18. This is unlike other studies, such a big sample of middle-aged male twins. So in this, they measured 4 lifetime symptoms of suicidality, which were from the diagnostic interview schedule. These 4 important questions or symptoms that they kind of did were thoughts about death, wanting to die, thoughts about committing suicide, and then the bigger question, the attempts of suicide or the actions they did or sought afterwards. They also measured the number of symptoms as well as the duration. So a little bit into the results. Same gender sexual orientation is significantly associated with each of these suicidality measures. So thoughts about death are about 4.4%, wanting to die is about 4.1%, suicidal idealization is 6.5, and attempts of suicide is 5.1 for any suicidal symptoms or attempts of suicide. This study also had an adjustment for substance abuse and depressive symptoms other than suicidality. And this suicidality measurements remain significant across all 4 of these things. So a conclusion, there's substantially increased lifetime risk of suicidal behaviors in homosexual men compared to any other group. This is unlikely due to solely substance abuse or any other psychiatric reason, as the study have ruled out. Underlying causes of suicidal behavior remain unclear, and future research needs to address inequalities in both measurement of both sexual orientation and suicidality in population-based samples. Of this, reports and lifetime measures of suicidality are strongly associated with same-sex gender orientation. It cannot be explained that abuse of alcohol and other drugs in non-suicidal depressive symptoms were not found to be significant in this study, which they often are kind of thought to have been. Also, non-due to numerous unmeasured genetic and non-genetic familial factors account for co-twin control design. So in the future, one should conduct other population-based samples and could measure their designs to address associations that are considered with genetic and non-genetic familial factors of suicide, which the study unfortunately did not look at. There's my reference. Thank you for listening to my presentation.